This video presentation and its accompanying materials are copyrighted by the American Association for Respiratory Care, AARC. Any public display, sale, copy, or distribution of the video or materials may only be undertaken with the prior written consent of the AARC. As a registered participant, you are authorized to duplicate course materials for this program for each participant viewing at your facility. This presentation and accompanying materials can be used by staff within the institution, but cannot be resold, distributed, or displayed for profit. Copyright 2020, all rights reserved. The following is a presentation of the American Association for Respiratory Care. Welcome to Current Topics in Respiratory Care. Today's topic is Closing the Gap, Improving Critical Thinking Skills for the Respiratory Therapist. Shelley Michoud is a professor at the School of Community and Environmental Health, Old Dominion University in Norfolk, Virginia. Shelley Michoud discloses relationships with Association of Schools of Allied Health Professions, Bon Secours Mercy Health System, CoARC, and JB Learning. Brand names of products and/or medications may be mentioned only as examples of technology. Any use of brand names is not in any way meant to be an endorsement of a specific product, but to merely illustrate a point of emphasis and to provide information and education regarding the availability.
What is critical thinking? It is such a nebulous and overused term. And like most words that we use in most language, it tends to have multiple meanings. So I do have to spend just a little bit of time talking about what is it. And it really is not just a single skill, because you could have critical thinking ability or skill, but you may not have the attitudes of how to use those skills, and then you may not behave as a critical thinker. Not surprisingly, critical thinking is the #1 competency desired by employers. And communication is closely integrated with that, and for me, I view them as very interrelated. And we know that critical thinking, regardless of whether it's respiratory care, another health profession, or a different profession or workplace, it's directly related to organizational effectiveness and outcomes. So it's not surprising then that it's the #1 competency that employers want. Our ability to think critically is what makes our organization stronger and better. And I applaud you for being here and wanting to know and apply your own critical thinking. The word critical comes from ancient Greece. It doesn't mean to be critical as in this little cartoon here, if you can read it. He's reading a book on critical thinking and cussing. It's the biggest piece of blankety blank that he's ever read. That is not necessarily critical thinking. It might be, but critical thinking comes from the Greek word kritikos, which means discern judgment, and krition, which means standards. So critical thinking then means discern judgment based on standards. Here's one definition of critical thinking, and I'll spare reading it to you because you can read faster than I can speak. But you'll notice in this definition that a lot of it is evaluating, synthesizing information. And it's information we observe, we experience, that we reflect on, that we reason about, that we communicate. So again, communication interrelated. And then it guides what we believe and how we behave, how we act. Critical thinking of any kind is never universal in any of us. It would be totally exhausting if we critically thought about everything we did. So today you might have noticed it was cold and windy, and you grabbed a jacket. Maybe some of you grabbed an umbrella. You didn't have to critically think about that, but you did make a decision and you acted. We all have episodes of undisciplined and even irrational thought. No matter how hard you work at being a critical thinker, we all have irrational thoughts from time to time. So what are critical thinkers? If we start at 12 o'clock and move around, a critical thinker is someone who is an active listener, who continuously revises their thinking based on input or context. If when someone is speaking, you're thinking what you're going to say, that's how you know you're not critically thinking, all right? Because it requires you really listen to what someone else is saying. Moving along, you're open to new information and you seek evidence to draw your conclusions. You're capable of understanding the logical connection of ideas. This next one's a big one, because critical thinking is related to intelligence. It's also related to emotions. We need to be aware that when we're stressed and when there's differences of opinion, it distorts our thinking. And our thinking is our own creations. What you think is a creation of your own thought in your own mind, and we're wired to defend what we create. That's natural, that's human. But when we're stressed out, that's when we'll tend to dig in and stick to our own personal opinion and not be open to other data, other information, new information. Critical thinkers are able to consider multiple perspectives and understand your own biases. If you've ever been with me in a meeting, you'll sometimes hear me make a recommendation, we talk it out, and in the same meeting I'll say, I'll actually disagree with what I recommended and say, I agree with Ian. That is what, and Sarah's nodding. She's my witness that I'll do this in co-arc meetings. But what that means is, one, you have to be confident, but that means you've listened to the other perspectives, you've reasoned about what you thought, and you've changed your mind. So we should role model that for students, for patients at the bedside, in our personal lives, we should be critical thinkers. And the key here is reflection, and we continuously evaluate our own thinking for faulty reasoning. And no one thinks critically all of the time. It would be totally exhausting. It's okay and even good that a lot of what we do is automatic. But we do have to recognize biases very much influence how we think, what we think. Here's a little cartoon just to break it up early in the morning, but it looks like their sales are pretty flat, straight line there, and they're trying to come up with how we're going to improve it. And they're going to make a decision, but only after they consider 5,243 factors. So I have a feeling that line might continue to stay flat in this particular scenario. So again, putting a visual to what I just said in words. This is a definition of critical thinking that I've used because it summarizes all the elements that I feel are important. Critical thinking is logical reasoning, problem solving, and reflection. Reflection taking into account thinking about your thinking. And it's needed to effectively practice respiratory care. So let's look at these, not in any deep detail. And this visual shows them as kind of balanced, but they're not equal. They vary depending. Some problems you'll need more logical reasoning than others. Some problems or solutions will require more problem solving. But regardless, there should be reflection. So with logical reasoning, this is pretty much looks like the scientific method, doesn't it? Gathering, applying, analyzing, synthesizing, and then logically making some type of conclusion. With problem solving then, based on your logic, you'll draw a conclusion, you'll form a belief, and you'll take action. So it's the problem solving that translates our logical reasoning into some type of thought, behavior, action. And then finally, reflection. What are our thoughts, decisions, beliefs, and actions? But critical thinking, no surprise, is tied to emotions. And some people say it's only a negative emotion, a tragedy that shakes us to our core to where we'll fundamentally change something we maybe believed or thought our entire life. Some of the newer studies, and I'm happy for these, show that humor is very related to critical thinking. And comedians are probably one of the best examples of critical thinkers, because critical thinkers and comedians, they question authority, they challenge assumptions, and they typically play the role of outside observer. And to me, this is what you do when you reflect. When you reflect, you're removing your own emotion, experience away, and you're thinking as an outside observer about your own thoughts, beliefs, and actions. And comedians do this all the time and do it well. And it's the element of surprise where a comedian explains both the ordinary and the extraordinary that we find so much fun. Critical thinking tied to emotions. Let's see if this little kid will start. I love this. Okay, I'm a grandmother of 2 granddaughters, aged 2 and 8 months. I love everything about babies these days. And so I'm glad I heard a lot of laughing, and I hope it wasn't just the grandmothers in the room. But I'm showing this slide for a few reasons. One, we only listened to a lecture for 9 minutes, and then thank you for not pulling out cell phones, at least the first 2 rows where I can see, because we're meant to be active. And after 9 minutes, we don't hear anything. So when you're talking to your kids, your spouse, your students, each other, keep that in mind, and you have to break it up. So I like to put humor into my talks, but this particular slide, I was fortunate to find when I was preparing for this Kittredge lecture, in that it was actually used in a study of critical thinking. And they had 3 groups. One group had this video. It's much longer. I used Capwing and shortened it down for today. Had this video. Another group had a tragic event. They had something, I think it might have been an earthquake or some type of natural disaster. And a third group that was neutral. Then they gave the participants a test that involved, like a game, pattern recognition, and they assessed performance. The group who saw this video as part of the experience scored the highest in critical thinking. And what the authors conclude, which I agree, and it's been my own experience, and there's other studies that have supported this, what this study shows us is that humor actually frees up the mind. Now that you've all had a little chuckle, you're a little more open to hear what I have to say, and that you're certainly at least alert, which is part of active listening. So thank you for laughing for that. So why is critical thinking important to respiratory care practice? These are the big ones. These are my opinions, and there is literature to back it up. But it is critically, and I hate to use the word critical twice, very important to build evidence-based healthcare. When you saw the definition and the skills of critical thinking, many of those are just fundamental to evidence-based practice. Nowadays, we're focusing on interprofessional practice. It's really not new. It's been, Institute of Medicine has been advocating this for at least 40 years. But we have to work in teams, and there's core competencies that require critical thinking, communication being one of the collaborative practice competencies. We know that teams that work and display the skills and competencies of interprofessional collaborative practice, there's data and evidence that shows it improves patient safety. Patient safety, some examples would be not having falls, infections, and reducing human error. Critical thinking and related to team-based approaches to care, where teams are effective and communicate and solve problems together and actively listen to one another and have a shared ethic and respect for each other's opinions and thoughts, and have reflection that they're open to hear and change their own opinions. They actually achieve patient satisfaction and health outcomes. Critical thinking may or may not attain effective and efficient care. The data's out on that. Pay for performance doesn't really seem to be working. And we know we have to work on not having, say, our COPD patients readmitted within 30 days. So there's a lot we can do there. But not only does it increase patient satisfaction, studies where there's team-based care and interprofessional practice demonstrate that they're able to have improved reputation, an increased market share, and related to that, a retention of employees. So if you want to retain your faculty, your clinicians, your managers, your supervisors, your patient educators, your navigators, whatever area of respiratory care you're working in or aspiring to work in, you really have to actively engage in employee satisfaction. And in my opinion, critical thinking is fundamental to that. And finally, we need to develop and expand the professional roles for respiratory therapists. Back in '97, Neil McIntyre and I presented at one of the journal conferences for Respiratory Care Journal, and we wrote an article on expanding the professional roles for respiratory care. You can still find that article on PDF if you Google it. But if you read the, not only the article, but you read the comments where there's, in those particular articles, there's actually a printing of the interactions, the discussion part from the journal conference. But that's back in '97, and we're going back and forth on what is the role. And that paper essentially differentiates between what is a technical role and what is a professional role. And there's a lot of literature ever since 1929 and maybe before that with the Flexner report on what it means to be a professional. And professional skills and roles are different than technical roles. And there's some in the discussion there, and I know there's been debate for many, many years, but in the discussion it says, and I'm the one saying it, it says, I don't believe the associate degree is going to be sufficient for the professional role of respiratory therapist. When you do the math, that was 22 years ago. And I think as a profession, we've done a great job describing the competencies we need for professional respiratory care. The 2015 and beyond conferences do a fantastic job of saying what are the competencies we need for 2015, which, by the way, was 4 years ago. So we're already in approaching on 2020. So even before the '97 paper that I just mentioned, there were other documents, there were other studies, and we've repeatedly said what we need to be professional respiratory therapy. What are the competencies we need? So we've done a great job with that. What we haven't done as good with as a profession, and I take responsibility being a respiratory therapist and being involved in the profession, we haven't done as good a job as coming up with a strategy of how to achieve the competencies that we've been stating explicitly for more than 4 decades what we need. So I hope that I'm glad we no longer say we're at a crossroads, because if you're at a crossroads for 30, 40, 20, 10 years, that's not a crossroad, all right? That's a train station stop or a bus stop or a red light, but it's not a crossroads. So I'm glad we've dropped that from our language, and I have confidence that finally we'll move on. And maybe the timing is never good, but I'll elaborate a little bit more in this talk. With critical thinking, if we start at problem-based learning, this is my own visual in preparing for this talk of how I view the world. So it's my worldview that in order to have, if we start with evidence-based medicine and go counterclockwise, To interpret and apply evidence for clinical application. Our clinical practice guidelines, our Cochrane reviews, these are all examples of critical thinking. When there's a meta-analysis done, which is a study of studies, and then a conclusion is drawn to form evidence-based at the highest level, then that is an example of critical thinking in action. For students and educators, we apply critical thinking whenever we're learning a new subject matter. Passively sitting here in a lecture hall isn't really critical thinking. I feel almost guilty talking on this subject in this type of format because it goes really against my fundamental core beliefs of how people learn and how people change points of view. So problem-based learning, instead of lecturing, you give students the problem and you have them work through it. And you have them do the research and draw conclusions. And that definitely improves their ability to use logical reasoning, to problem solve, and to reflect. It's a little too time intensive, so we have various opportunities to implement that and other mechanisms. Interprofessional education, then, is respiratory therapists learning not just with other respiratory therapists, but learning in teams. And why this is so in demand right now is if we don't prepare health professionals to function effectively in teams, then why do we expect magically when they get out and practice, they're going to know how to do that? So this particular talk is labeled as an educational lecture. Personally, I think sometimes labels are limiting. Why isn't this topic a managerial topic? Why isn't this topic today a clinical practice topic? Because if it's educators talking to educators, or if it's me talking to all the critical thinkers that got up early this morning, it's not going to move. It's not going to move the dial. And then finally, collaborative practice is working in collaborative teams to improve our outcomes. So what do we know about critical thinking in respiratory care? As Rich said in the introduction, not a lot, but that we're not unique. It's a complicated, any type of social sciences research is very hard to control for variables and come to then some type of publication. So in preparation for this, I Googled, did a lit search through my library, through my work, and said, well, how many publications on critical thinking? There's millions of them. Well, then if you hone it down to how many are peer-reviewed papers, we get down to about 670,000. Then if you put in the keyword respiratory, it comes down further to 55,000 plus. How many are peer-reviewed? Well, only 15,000 of those. So you see, we keep drilling down on the evidence of what we know about critical thinking. 87 are specific to, you have to put in both the terms respiratory therapy, and I was missing a lot of them, even ones I was aware of. You have to put in the terms respiratory care because they could be under either search term. 48 then are peer-reviewed articles. Out of those 48, 18 are published in our journal, Respiratory Care. And from what I could tell through looking at those 18 publications, 5 of those I would consider actually research papers. So you see, it drills quite a bit down as we look at the different levels of evidence. There's about 37 research studies on critical thinking and respiratory therapy, and 18 of those are dissertations. So if any of you have done your dissertation, I encourage you to publish it. And if you're working on your dissertation, then we look forward to seeing your publication. My research was on critical thinking and respiratory care, and I did a qualitative study, one of the only ones I've ever done because it was just way too hard. But I did that study because I doubted that qualitative research was, quote, real research. I love statistics, I like math, I like numbers, I like data, and what is this qualitative? So when I was in graduate school, I took the hard route. If I had to do it again, I'd do it differently, because it was at personal sacrifice that I did my dissertation research. And then I was so kind of shell-shocked. So if any of you are working on dissertations and just feeling overwhelmed, it will pass, but you have to be determined and persevere. But then I never published it. It just kind of sat there because that was the last thing I ever wanted to really look at again because it was just too much. And Dave Pearson, another critical thinker and role model, mentor, and someone I couldn't go as far as to say a friend, but certainly a mentor to me. We overlapped on my service on the Respiratory Care editorial board. And for those of you who don't know, he's the only physician editor of Respiratory Care. Under his leadership, the journal has actually got into Index Medicus in 2000, so now it's not these just PDFs. You can actually search the research published, making it more desirable to submit your work there. But he kept encouraging me because he saw my abstracts that I presented at Open Forum. He knew about my dissertation. He didn't see any papers. And he kept on me. And I kept saying, but I don't know how to take a 500-page dissertation and turn it into a short article that's still true to qualitative research. And the journal hasn't published qualitative studies. And for those of you who doubt still that qualitative research is real research, you probably understand and know about the stages of death and dying and use them. You probably know about child developmental stages and use them in your own rearing of your own children. So the theories that we use and the foundations of what we think come from qualitative research. And he worked with me. I finally put a paper together. It was way too long. And we compromised back and forth, kind of like I did with Phil Kittredge. And thanks to him, I'm here today. So thank you, Dave. So the publication that some of you have read and even incorporated it into your classes, I appreciate that, know that these are the skills that I found were important in respiratory care practice. So as respiratory therapists, what do expert respiratory therapists do? Well, we prioritize, we arrange our work, we respond to unexpected demands. We have to think ahead and respond to problems. Unlike some fields, we troubleshoot, we correct and locate technical problems. We gather and give information and communicate. We negotiate. Negotiate now is, we talk about interprofessional communication. That is negotiating. The difference between communicating and negotiating is when you negotiate, your intent is to influence someone else's ideas, thoughts, beliefs, or actions. When you communicate, you're wanting to share experience, information, but not necessarily sway another person's opinion. We need to make decisions and then reflect. So this is the findings that came out of the qualitative work. And Linda Goodfellow then, who's sitting right here, thank you, Linda, for supporting me and being here today. She actually took my work and did her dissertation and publications. So then it helped her work, helped validate that what I found really respiratory therapists thought was important to their critical thinking. She also found where there maybe could be some overlap, decision-making and reflection overlapped, prioritizing and anticipating integrated or maybe overlapped. We didn't go as far as factor analysis to decide that, but there's some evidence there. She found that the age of the respiratory therapist and the education level did not influence the ratings. That doesn't surprise me because we blend educational levels and credentials in our practice of respiratory care. She did find that we rated ourselves at the time that she did the study high in prioritizing and troubleshooting and communicating, but lowest in anticipating, which is thinking ahead of problems and solutions to avoid them in the first place. We know a little bit from other studies, myself, Tom Hill, Dave Shelley, Tim Oppold, all of us have found that respiratory education can improve critical thinking, and that's using a standardized critical thinking test the Watson-Glaser critical thinking assessment tool. There's others, the CCTA, and some of you, and I hope to see some of the other instruments used as well, because some of the initial work that me and my colleagues have done, we've used the Watson-Glaser, so others have done that because we learn from one another. But it's encouraging that respiratory therapy education, we do have data, actually does improve or can improve critical thinking. These studies show statistical significance. However, the effect sizes, or the percent of the intervention that explains your finding is small. But that's not unique. In social sciences, our effect sizes are often small because it's impossible to control for all the variables that impact what we're looking at in human behavior. So that is not at all atypical. There's also, these studies have shown some relationship to both critical thinking on the WGCTA and the self-assessment exams through the NBRC. Studies followed showing problem-based learning relate, and the most recent study, the last one there, that Wetstein and et al. Did, that was just published in Respiratory Care not too long ago, they found a correlation between a strong science background and critical thinking. So how do we close the gap? Well, these are the factors that affect respiratory therapists' critical thinking: our dispositions and our motivation, education, the context, and professional development. We know that certain motivations to think critically, remember, you have to be an active listener, you have to be willing to think about your own thinking, change your mind. It requires intelligence, but it also requires other things. I think some of my slides might have skipped over, but that's fine because we have about 13 minutes. So our dispositions and motivation for critical thinking, we want to attract people. I know when I entered respiratory care, there was 40 students accepted. It was very competitive, and there were 200 applications to get into the program. There were 80 students. It was the highest paid allied health profession at the time I entered respiratory care in Syracuse, New York. So very motivated people with dispositions to apply themselves were attracted to the program. Today, we have a much more difficult time of attracting people who have the inherent disposition and motivation to critically think. Why is that? Well, Bill does all the talks on the generation, the millennials, and I don't know, all the alphabets, Y and X, and you've been to his talks. So we know there's generational changes in how people respond, and we also know that the number of college-age students is falling, and everyone is having difficulty meeting admissions quotients. We know higher ed's not that affordable. The cost of higher ed has outstripped the increase in costs of health care. So the talk used to be about health care costs, but now the public, little by little, because those loans are coming home to roost, we're starting to hear a lot that it's just not affordable. It's too expensive. So there's a lot of competition for recruiting the students to begin with. So that's a real issue that we're having to deal with. The education context and continuing professional development, let me get into a little bit. Can you teach it? I wish I had a magic bullet today, and I hope that's not why you came, because there is no magic bullet. And look, this is an old slide. Look at the size of those monitors. My God. So this slide shows you just how fast technology thinks. My husband will say, well, we won't be too bad when we're old because we're pretty tech savvy. And I'll say to him, the things that they're going to come up with in the next 10, 15, 20 years, we can't even conceive of. And we'll be like any other prior generation and asking the grandkids to help us. So I'm glad I have 2 granddaughters. But there's no easy way to do this, unfortunately. We know through educational preparation, this is a very recent study, And these are people, senior years of a bachelor's program. So I'm not talking associate degree, I'm talking seniors. A third of seniors today, graduating from universities and colleges, they couldn't make a cohesive argument, they couldn't assess quality of evidence, they couldn't document or interpret data in a table. Hopefully this is none of your students, and we are making sure that our students can do this. We must replace lecturing with active learning, and I know many programs are doing that. We have to incorporate critical thinking across the curriculum. And one of the biggest factors that affects critical thinking is the more courses someone takes. So this debate about associate and baccalaureate, I'm a little getting weary of it, because all the data on critical thinking shows the more courses people take, and not just science courses. Wetstein and them showed a strong science background in respiratory care relates to critical thinking. But if you look at the critical thinking research, the humanities, the social sciences play a tremendous role in our ability to reason, to communicate. And the arts and the sciences together prepare a strong critical thinker. So, and the more courses people take, the stronger our ability to think critically. So I think we need to stop debating, is one the same? And I've heard people say, well, the respiratory curriculum for associate and baccalaureate, they're the same. And they're looking at only the respiratory therapy courses, and they're not the same. All right, you have to look at education in the whole, because the way we think, reason, and critically think is our entire experience. It's the things we read, the things we've been exposed to, the travel that we've been on, it's all of it. I hope that we won't just have such a narrow view, but open up our viewpoint. And then preparing respiratory therapy for relevancy in the future. If you're not going forward, you are going backwards, because entropy is real. You learned that in physics maybe. And nothing just stays constant like that cartoon with the straight line. It's either moving forward, or it takes a lot of work, time, and effort to maintain. So you have to stay relevant, and the respiratory therapist of the future and the competencies needed that were published in 2015 have really helped us with what are those competencies. I've had a few paradigm shifts. Prior to 1993, I was perfectly content lecturing to my respiratory therapy students. I always taught clinical, and the health sciences fields, respiratory therapy in particular, they do have a lot of apprenticeship model, so it's not like other majors where you could totally lecture. We've always in respiratory care had the labs and the applied. The problem is I think we compartmentalize too much. We lecture with knowledge over here, we do psychomotor over here, and then we do clinical over here, and then we hope in the end we have a critical thinker who knows how to work in teams. And these two books for me was a paradigm shift. I've never been comfortable lecturing since 1993. And fortunately in my work now I teach online, and through that mechanism, I'm able to do a lot with students, and it seems much more authentic for me. And critical thinking not only impacts our respiratory care practice or our educational practice, but actually our everyday. So before 93, I expect y'all to be independent, creative, critical thinkers who do exactly as I say now. And Young wrote an article that the dean from MIT left her graduate deanship and is starting a university. I haven't kept up with where it's at now. That's totally project-based. Students working in projects, and I'll, in the article, make sure that follows this, make sure I update to see, has that university been accredited yet? Where are we at with it? What's their enrollment look like? Well, is critical thinking generic or specific? I tend to have a specific view. That means it's tied to the discipline. I could be a good critical thinker in respiratory therapy, but that doesn't mean I can critically think in engineering, or I can critically think in law, all right? So a generalist view would mean you just teach logic and applied reasoning and hope for the best, that people know how to apply it. This book that we wrote was ahead of our times in that it's definitely case-based critical thinking, and got great reviews, didn't get much good sales. And the reason I even am showing this here today is now we have online, and maybe it could be revitalized with online. But my point, whatever tools you're using, make sure the answers are not presented as concrete and solid, because there is no answers for a lot of the work that we do. There's no single one right answer. The evidence is often contradictory, the problems are messy, the patients are complicated, and we do our students an injustice and our colleagues an injustice if we are dogmatic that this is the way to do X, Y, or Z. One of the best things I think happens at the AARC Congress is these talks that are on the pro-con. I love those, and I hope we continue to do those, and I hope more people can participate in dialoguing on pro and con in addition to the speakers. We need a lot more of that type of view to really have more critical thinking in respiratory care. Can you teach critical thinking? You can do it generically, which would be the generalist view. The infusion view would be it's implicit in all that you teach. I think that's more the approach that's been used in respiratory care education. Immersion means it's explicit. And throughout whatever you're teaching, you're talking to your grad students, your students, about how this relates to their critical thinking. And mix would be a combination. It's probably where I land right now. My second paradigm shift was this book from Goldman, because our emotions can do the amygdala hijack, which is the flight or fight response. And in co-arc, we laugh and say, oh, she's thinking from the amygdala. He's thinking from the amygdala. When the emotions are in there, we're not thinking clearly anymore. And we need to really do a lot more in this area. In professional development, I really believe that we have to have more ethical scenario building. We have to have much more interprofessional competency-based. We have to value team-based care and have respiratory therapists as part of it. And have you ever had your own critical thinking assessed? You probably all have some idea of your IQ. Do you check on your own critical thinking abilities? Have you checked, or do you check your own emotional intelligence? I salute all of you obtaining advanced degrees. We should encourage that in our students. And to me, one of the best things that laid the foundation for my own critical thinking, in addition to Catholic education, real strict nuns in parochial school, because that was literally the foundation, was to obtain advanced degrees and engaging in research. But if you ever undertake research projects, then you are engaging in critical thinking, because just designing the study is so important and has biases in it. This is what we tend to do with faculty. Welcome aboard. Here's your prepackaged curriculum. If time permits, encourage critical thinking. So that's your experience. I think in all that we do, the more we can do to help educators, help students gain the skills, the better. Well, in the context of respiratory care, there's many organizational variables that affect critical thinking. And the ones that I found in my research and Linda's found in hers, and we probably haven't really published full articles of this, but there is evidence, and you know this when you have a supportive medical director. When the director of the department is a champion who believes in you and your staff. When the climate is more comfortable with shades of gray, not just black and white. When there's actually differentiation based on credentials. As a profession, I think we've done ourselves a disservice by having advanced respiratory therapists and maybe entry-level respiratory therapists. Our terminology is complicated and complex. We use the word advanced way too much, in my opinion. And do we have distinctions in practice between AS and BS graduates? Do we distinguish between CRT and RRT in practice? The research that I did said that if you do, then there will be more critical thinking. So my own paper that I've published says that, and these are the states that now have RRT only for entry to practice. In respiratory therapy, when I entered, it was the highest allied health profession, paying allied health profession. Today, it's about 15 to 20% below the average allied health professional salary. What happened? Critical thinkers, I throw that out to you. Why did that happen? What happened? And not to cast blame. We can blame educators, managers, clinicians all day long. Blame tripartite, we can blame the different organizations. That's not going to get it done. So we need to look at why are our salaries less than other allied health professions. And even if you go to the Bureau of Labor, it's less than other professions that are also predominantly associate degree. So if you compare salaries in respiratory therapy to dental hygiene, to radiation therapists, to clinical lab scientists, to nuclear med technologists, to an RN with an associate degree, those are all other associate professions. Ours is less. The time's running out, so I need to speed up. But the AARC Human Resource Survey has documented that for each degree a respiratory therapist earns, there's on average an increase in salary of about $3,000 a year. Salary, we want to keep them low to help with patients, but we don't want to just promote ourselves in our salary, but salaries reflect the professional value that the public perceives that we had. And it's not a bad thing to discuss salary. Every other profession is doing it, every other. And why should we then not challenge and discuss that? Because that's part of what it means to be a professional and a critical thinking. So in closing, to prepare respiratory therapists for relevancy in the future and closing the gap, I believe we need a unified professional identity. I don't think as a profession we ever really decided, do we have 2 levels or do we have 1 level? In our credentialing, we've had 2 levels all along, but in practice, have we differentiated between CRT and RRT, or have we blended the 2? Have we developed interprofessional competencies? Everyone who leaves here today, I hope you'll come to think about your own thinking and realize that educational quantity and quality does impact critical thinking. We have to stop comparing apples and oranges. There's been a few studies that try to compare respiratory therapists with an associate versus a baccalaureate, and made a huge, every study has not controlled for the variable that many associate degree RRTs already have bachelor's degrees. And so we're not comparing apples and apples, because I've already told you all of the educational data on critical thinking says the more courses you take in humanities, in sciences, and the quantity and quality of the courses affect your ability to think and perform. Well then, of course, there's not much of a difference, because I know most of the associate degree programs accept people who already have bachelor's degrees, and the tuition's lower. So it actually puts direct competition on those same people who could be going to baccalaureate programs. Critically read publications, avoid the amygdala hijacks, engage in honest problem solving. Blaming is not critical thinking. Saying we can't do it is not critical thinking. Doing the same thing the same way and expecting a different result is not critical thinking. And do we role model critical thinking skills and dispositions? So my last slide, and thank you for bearing with me, I went a little over. I imagine 4,000 years ago, I said critical comes from the ancient kritikon. So 4,000 years ago, I imagine these Egyptian gentlemen designing the first pyramid and saying it'll never work as a pyramid. It'll never work. Well, if you're a critical thinker, you could look at this from multiple perspectives. Another way is to say they were right. A pyramid can't fly, right? So I hope that we'll build strong pyramids and build on our foundations, and I appreciate the opportunity to speak to you. I hope I've challenged some of your beliefs and assumptions, and I hope that you'll reflect on some of what I said and do really good in your work. And I see some of my former students right in the front row, so it's been a pleasure. Thank you so much.